have to say she's a wonderful doctor. She is one of the very best I have ever worked in my life. She's always there, she's always empathic, she's very bright, and she understands what we are trying to do.
She has shown a compassion and understanding for the needs of the mentally ill that is often missing in an emergency room.
And I've always been very impressed by her extraordinary dedication to the patients that she cares for in our emergency department at Ball.
I was very surprised when I was told that I was a candidate, a nominee for this award, and I was astonished when I was subsequently told that I actually won the award, but I was pleasantly surprised and I was glad that that there was a problem going on in the emergency department. That's usually what I get calls about.
Our ED at IU Health Ball Memorial Hospital is very, very busy. We see almost 60,000 patient visits per year, and a large number of those visits have patients who present to the ED with mental health problems.
The number of patients presenting to emergency departments across the country with mental health illnesses or psychiatric illnesses has really skyrocketed over the past several years. It's been a really steady incline.
About a year and a half ago, the hospital initiated a performance improvement committee specifically to work on dealing with psychiatric patients in the emergency department. But it was also at that point that there was a real shift. I think you started to see a significant shift in the culture. Instead of just being frustrated with the challenges with those kinds of patients, really looking at, okay, how are we going to provide really good care to these people in collaboration with Meridian? And I think from that point on, it just started running very, very smoothly. And Dr. Drummond played a big role in that performance improvement project.
One of the really wonderful things about Dr. Drummond is her ability to work collaboratively.
We've been able to communicate and develop a type of collaboration that is really rare in my experience in hospitals and emergency rooms.
Dr. Drummond's really been a pleasure to work with. Well, we have what I think is a very positive collaborative relationship.
It is very much a collaborative effort, though, to take care of all patients in the emergency department, but particularly those that present to us with mental health issues. We have very difficult patients that we share. I do not ever feel that this is my problem and I'm trying to get Meridian to help me. The moment I make a call to any of those people or to any of the social workers or psychologists that come and do face-to-face interactions with our patients, from that very moment, it is no longer just my patient, it's their patient too, and I know that I've got a partner. I can't imagine what it would be like if Meridian Services weren't there. They do an incredible job for our community, and I'm very thankful that they're here. I think that really all of the nurses, all the techs, all the unit secretaries in our department really feel the same. We don't get a lot of honors very commonly, but I think that even when we do, when something like this comes up, everybody pretty much thinks, you know, that's just my job.